Amy Cole, who works at the Booth Gardner Parkinson's Care Center, and she's going to talk to you about how to be your advocate in the hospital, in a retirement facility if you live there, and with your doctor. The Northwest Telehealth is producing today's program, and our host is at Booth Gardner Parkinson's Care Center at Evergreen Healthcare. I'd like to thank our sponsors. Our sponsors are Parkinson's Resource Center of Spokane, Albertsons, Northwest Parkinson's Foundation, and all of these sites and our other sites. We'd like to thank you for being a part of our program today. And of course, we'd like to thank all of our volunteers that are involved in putting this telehealth meeting together. We're going to have Amy, our speaker, and then the last half hour of our meeting, we're going to go to each site. And then when we call your site, just press your button on your mic so we can hear you. And then I'd like for you to tell me how many people are in attendance, and then any questions that you have. So during the time that Amy is speaking, be sure to take your notes, because you will have an opportunity to ask questions during our question and answer period. Amy will be speaking about, 45 minutes, about 45 minutes or an hour. And then we have about 30 minutes or 40 minutes or so for question and answers. All right, I'd like to introduce to you. And we have to do some maneuvering here because the way our setup, if we move far to the right or far to the left, you can't see us. So if you can see our little heads, and we'll both smile, so you know we're human beings here, all righty? And I want to introduce to you our speaker, Amy Cole. Thank you.
All right, thank you very much. I'll move back behind the podium and start talking and kind of introduce myself a little bit back there, but I want to turn off the lights so that you're sure to at least see the PowerPoint so you can follow along. At least you can see one of the things that are presented. So hold on one sec. All right, so my name is Amy Cole. I've been an RN at the Booth Gardner Parkinson's Center for about 2 years now, working with Parkinson's disease. It's been an awesome privilege to learn about Parkinson's disease, work with our patients there. But one of the things that has never really changed for me as a nurse through all of nursing is learning how to be an advocate for my patients, teaching them how to be advocates for themselves, and bridge that gap between doctors, therapists, kind of an all-around care coordinator. And like I was saying, if anything I would hope that my patients take out of that is that they would give them confidence to do the same for themselves. So Parkinson's, unlike some forms of diabetes, unlike sometimes even cancer, it's a chronic illness. It's a progressive neurologic disorder, degenerating, so it gets worse over time. So really what that requires of people is a change in lifestyle and modifications that adjust to the degree of their disease, the progressing of their disease, where they're at, and so forth. Treatment might be complex. It might change over time. In fact, it's expected to change over time. Medications, non-medical therapies, wellness-based treatments for the mind, body, and spirit can all be incorporated into that, as it is a lifestyle modification. And what's ultimately important is that you as the patient have the front row seat to what works and what doesn't work for you. You know best of all, is this medication doing what it's supposed to do? Is it helping you? Is it hindering you? Are the side effects manageable or not? You are in the best position to keep track of what has worked. That being said, when you get into your doctor's office, it can seem just like a quick lineup. Lining up to register, lining up to get in, take your weight, take your vital signs, sit in the room. Well, am I the next room up, or am I the second to next room up, or heaven forbid, the third? And then you see your doctor for a brief moment and you're shuffled back out to scheduling, schedule your next appointment, and before you know what happens, you're headed in the car back home. So if anything you can take from this, I might not be able to change what your doctor's office does, change the time that you're in there with your physician, but hopefully I can empower you to take active role in care of your Parkinson's, feel entered into a partnership with your care providers, whether that be your doctor, your therapist, the staff at the nursing home, providers at the hospital, and minimize your helplessness. Parkinson's can make you feel helpless enough as it is. We don't need to feel helpless because we can't communicate with our doctors, because we can't communicate with their staff, because we can't communicate with our family members. And ultimately optimize results from that relatively short face-to-face time with your doctor. So first, encouraging you to take an active role, and this is as it pertains to anything, whether it be the hospitalization, the doctor's appointment, being in a long-term care facility. First and foremost, be aware, know what symptoms you have. Not all patients with Parkinson's some will have similar symptoms, but not all have the same. Some people with Parkinson's don't have tremor. Some do. Know your symptoms, know your medications and that you take for those symptoms, and what side effects that they could have, what side effects do you have from them. Participate in your appointments. Be prepared for your visit. Be clear about what you want and what can be achieved, but make sure that you're setting realistic goals. Listen and assess. Do you understand what you're hearing? Are you able to ask your questions? Think holistically. Step back and look at the big picture. How were you, not just this last day, not just this last week, but the whole time from when your last visit was to now? Are you just this last month, just this last week, having a lot more tremor, having a lot more control with your medications? Are you wearing off more? Has that been the overarching concern? Also, what other factors could be playing a role? Is your arthritis really bad? Is your diabetes out of control? Are you having heart issues? Did you fall? And then lastly, establish and maintain your Parkinson's support team. This includes the providers, therapists, your family, your friends, anyone that may be helping in your Parkinson's. I extend that to say anyone who is aware of your Parkinson's. People can provide support to you in ways that you don't even know. If they know you have Parkinson's disease, they might be reaching out to you in some form or another. And I really want to highlight in this your care partner. I think that sure, that can be a spouse, that can be a child, that can be a friend, but I really, really encourage you to find that one key point person that can be there with you, that can help you see things more objectively. You might call them a nag, but that's kind of the role that they play, and it can ultimately be pretty helpful too, as annoying as it is. And that they might help you record changes and implement the recommendations given by the doctor. They might catch things that you don't. They might have questions that need clarification too, that you might not think of. So there are a lot of obstacles when you walk into a doctor's office, when you go into the hospital, when you're at a long-term care facility, that might get in the way of you understanding of your conversation with the doctor. First and foremost, that's the all too familiar anxiety. We get in there, we get anxious, they're getting my vital signs. Is my blood pressure going to be high? Well, whatever. What are you there for? Yeah, I completely forgot because my blood pressure, I'm so concerned about that. Or it's really hard to concentrate when you have anxiety issues. When you're learning things for the first time, you might not catch everything. If you're new to Parkinson's disease or you're new to symptoms of it and you're not quite sure what they are, how to take care of them. If you're learning new medications, just let alone how to pronounce the name of the medications, you might get stuck right on that point and miss completely what it's for, what the side effects might be, when you're supposed to take it, how you're supposed to to titrate up on the dose. So learning things for the first time, being a beginner, is always a hurdle. Hearing problems. If you use a hearing aid and it's not functioning, multiple medical problems. You walk into the office and you have other things going wrong in your life. It's hard to weigh what might be the most important thing to you at the moment to take care of. You might say your Parkinson's is fine, it's under control, in comparison to your hypertension, your high blood pressure, your diabetes. Distractions. Is your whole family with you in the room? Are you refinancing your house? Are you worried about the traffic? Is the medical assistant switching you from room to room? Is there noise going on outside? Those can all make a difference in what you get out of your appointment. Memory issues. If you have trouble with short-term memory, you're going to have trouble with remembering what the doctor says, with remembering what you want to tell your doctor. Or in general, just trouble expressing yourselves. A lot of times with Parkinson's, you have trouble with speech, whether that be word finding, a soft voice. As many soft speakers as we get in the office, we still have trouble understanding them a lot of the times. Or just even hesitant to ask questions, not even going there. So the first step to overcoming any of those obstacles is first and foremost organization, organizing your information for your medical visit. It's cumbersome, it's annoying, but boy is it worth it. If you have the information that you and your healthcare need at your fingertips, it optimizes the time that your physician is able to spend with you face-to-face, having a conversation, rather than going back and the doctor has to spend time looking up tests. Where did that MRI go? Really, what medication are you taking? What did we do last time? It just saves a whole lot of time. So on the day of your appointment, if it helps, and it usually does, try to arrive early. If you haven't completed a questionnaire form that your doctor has given you, that'll give you time to do that and maybe sit and reflect on it if you haven't already done that. The point of those questionnaires is we need to know your doctor needs to know certain information about you that might be general information, important for Parkinson's disease, important for movement disorders. Questions like, are you having hallucinations? Are you having night sweats? Are you having trouble sleeping? Are your meds wearing off? Those are all things that we need to know that may be related to your Parkinson's and have an effect on your treatment. I know that for us, we like to get a list of your medications, and it's not just a list of your medications. We want to know the dose. We want to know how many tablets and when during the day. We give you a lovely big grid to check it out on. It's a mess, but it's worth doing because your doctor can take a look at it, get the information they need, not have to spend time filling that information out and understanding it, and go right to addressing your issues. So, when you're thinking of where to start, try to remember, where did I leave off last time? Was I able to make any of the changes recommended at my last visit? Why wasn't I able to if you weren't? Did the medication not work for you? Did you go out of town on vacation? Did you fall and break your hip? Write down your goals, concerns that you want to talk about at that appointment. I wasn't able to make my changes because I went on vacation, but my goal is to pick right up where I left off I noticed I was having rigidity and I'd like to address that. Make it easier for the next time I go out of town. Include specific questions or concerns. Prioritize them from most to least important. If you put your most important first, you're sure to get that addressed. Least important at the end, hopefully you'll get to it. And allow room to record your answers. If you're like me and you don't write it down, you lose it. My pad of paper is my brain. Sometimes patients keep a journal or a diary. You can become your own historian with this disease. You can write down when it started, what medications you took, all of that. I recommend it. If you want to write for it, go for it. If you want to keep some sort of log of all these changes, it's very helpful. A lot of times what happens is later down the road, your doctor might ask you, well, have you ever been on this medication? And sometimes you might answer, I think so. Well, why did you change from it? Well, I don't know. This is where a journal or a diary would have come in very handy. You can record all of the recommendations that you've had, therapies, medication changes, the purpose of those. Why did you go to physical therapy? Was it to focus on your gait? Or did you focus on freezing? Did you focus on shuffling? Or did you work on activities of daily living? And was it helpful? Any diagnostic tests, labs, MRIs, CAT scans, now they have the DAT scan. Keep it all in one place. That journal, that diary can be a 3-ring notebook that you keep all of this information close at hand, ready to thumb through. If the doctor has a question, you're right there and ready. And then back to medications. Keeping that current list of medications readily available. Like I said, carbidopa, levodopa, you could be on multiple medications for your Parkinson's, but knowing specifically why they were prescribed will be helpful. Carbidopa, levodopa, was that prescribed mainly to help with your gait, with your tremor? Is it doing that? And then be sure to include any over-the-counter medications and supplements, vitamins, melatonin. Anything that you can buy over the counter is still a medication. Anything that you use for the purpose of your health can be considered a medication, and your doctor needs to be aware of that when they prescribe other medications for you. So help provide a complete picture, and that's kind of what I was just saying. Complete your list of medications, not just the name of it, not just the color of it, not just that one medication for my Parkinson's, and then I have this other one too. Not my blood pressure medication, not my insulin. Know the name of it. If you can spell it, that's fine. Keep it written down so you don't have to pronounce it. That's fine too. The dose of the medication. How many you take and at what times. We start getting into taking our medications for Parkinson's more than 3 times a day. Timing becomes everything. Knowing how many tablets you take, how many capsules you take, and what times during the day is such valuable information, especially if you have trouble wearing off, or if you have trouble with side effects. All right, so now you're prepared, you're in there, and you need to start asking questions. Your doctor wants you to understand your treatment. They didn't go into medicine so that they could just write orders in a secret room and hope that you get them and follow them. They want you to understand them. Most doctors that I talk to love educating you about what they know. So if you ask questions, they will most likely have an answer for you. And your doctor wants to understand you. They're interested in you. They're interested in your unique experience. They're interested in what sets you apart as a patient. They want to prescribe something that is individually recommended for you. So, questions to ask. My favorite is it my Parkinson's? Is this symptom related to my Parkinson's? I have hot flashes at night. Is that related to my Parkinson's? Is my constipation related to my Parkinson's? My back pain, is that related to my Parkinson's? What symptoms should I look for as the disease progresses, or in my case, if I already have a tremor now, what can I expect later down the line? What symptoms should I report immediately? What do you need to know about immediately? Is it troubles with swallowing? Is it trouble with gait? How many times should I fall before calling you? Hopefully just once. And what are the most common side effects of my medication? If I'm getting a new medication, or even if you don't know the side effects of your current ones, what are the main side effects that I could be looking for? Are there any known drug interactions with my medications and the things that I take over the counter? How often should I make an appointment? What is a realistic time frame for coming back and seeing you? And in this one, keep in mind what you feel comfortable with as well. If the doctor says, you're doing great, come back in 6 months, and you don't feel that you're doing that great, and you want to come in sooner, let your doctor know. Where can I find more information about my symptoms? What resources are there for me? Your doctor has learned their information somewhere, and I'm sure that they know where to find help for patients outside of their office. When should I see a physical therapist, occupational therapist, speech therapist, neuropsychologist? And how often should I see those? Any questions that you have, ask them. Then you get your recommendations, you walk up and down the hall, you tap your fingers, you get that little part for your doctor. And is that the end of the visit? Well, you probably have your recommendations from your doctor. That can be your new set of goals. Be mindful of the progression of your Parkinson's, how you did getting to your last appointment, and the obstacles that you faced. And that'll help you predict how to set your course for the next visit. Again, if you go home and you think of questions, don't wait until your next visit to ask. Call your doctor's office, speak with their nurse, speak with their medical assistant, get your questions answered, report side effects if you have them. Don't wait until that next visit to report anything, because we want you to move past those issues. We want you to progress past them. We might have to get you in the office sooner, but don't wait that full amount of time between appointments to get your questions asked and answered. So I'm going to kind of switch things right here, because I'm going to go into the hospital form. And I didn't really have to create anything myself for this. I was able to poach this just fine off of the National Parkinson's Foundation. Has recently come out with a campaign called Aware and Care. And we knew this as a center, that people had trouble advocating for Parkinson's disease in the hospital. But until they came out with this campaign, we didn't have any true understanding of how much of an impact people going into the hospital with Parkinson's disease was affecting people's outcomes and their care in the hospital. A lot of times people will say, well, hospitals are safe, right? They've got the hospitalists there, they've got rounding neurologists, If they have questions, they'll automatically call my neurologist. The pharmacy there, they have all the medications. They'll be able to supplement my medications. Staff there, they're nurses, doctors, they'll understand Parkinson's symptoms and what can show up. They'll bring me my medications on time. You know, they have the schedule, they have the staff, they'll do it. And they'll know what drugs are unsafe, what drugs I can't have with my Parkinson's disease. But what the National Parkinson's Foundation looked into and found was that 3 out of 4 people with Parkinson's who go into the hospital, that they do not receive their medications on time. And we know that timing can be everything for Parkinson's patients and their medications. 1/3 of those patients did not get their medications on time, that didn't get their medications on time, had a serious complication from it. When you have Parkinson's disease, it adds another comorbidity on top of everything else. People with Parkinson's, automatically, they found, are hospitalized 50% more of the time than people without it. And people with PD tend to suffer avoidable complications at a higher rate than non-PD patients. People with Parkinson's are therefore in the hospital longer because their Parkinson's might complicate how they're healing from a knee replacement, how they're recovering after a fall, how they're recovering after a colonoscopy or just even a general procedure. So why is this happening? Well, it's happening because staff in the hospital, unfortunately, don't understand every outlet of Parkinson's disease, the symptoms, the treatment. They don't understand the importance of medication timing. If you're taking your pills every 2 hours apart and it's scheduled that way, technically the hospital, the staff there, per hospital policy, have a half-an-hour window in administering that medication. So if your medication is due at 2 o'clock, they can give it to you at as early as 1:30 or as late as 2:30. And that can mean everything when you're taking them every 2 hours, every 3 hours, even every 4 hours. Sometimes medications that are on the blanket order for certain symptoms, pain, nausea, psychosis, confusion, are not safe for Parkinson's disease. If your nurse says, my patient is having nausea, the hospitalist will probably prescribe Reglan, Compazine, not good medications for Parkinson's because they can worsen your Parkinson's symptoms. Hospital pharmacies don't always stock a full array of Parkinson's medications. Mostly they don't stock Stalevo. And if you're on Stalevo, you know that you're on Stalevo because you can't get your dose right on just plain carbidopa, levodopa, or the combination with carbidopa, levodopa, and Comtan. So that's why you need the Stalevo. Ultimately, you yourself are your best advocate for your Parkinson's care, your care partner. That's where they are really helpful and come in, is they can be there at the hospital with you. They can tell the nurse when you're groggy from your anesthesia that, hey, we need to get these meds started right away or he's not going to be able to move. So the Aware and Care campaign was brought together to encourage you as an advocate, you as a patient, you as a care partner to really be able to take on that advocate role and be safe in not just the hospital, but also with your primary care physician. It has information that you can give your primary care physician or any other doctor that takes care of you. So in this kit, it comes, and this kit is free, by the way, and I can tell you how to order it, but it comes in a bag. The bag is designed so that you can put your medications in it, put them in their bottles in it, no Medisets, because the hospital will need to see your original medication bottles to identify your meds. Comes in a bag, so that you can put everything in there. Inside is a booklet that has a hospital action plan that walks you through all the steps of preparing to be an advocate for yourself, particularly in the hospital. But like I said, I think that a lot of this information is designed to be passed to any provider that participates in your care. It has an ID bracelet. The ID bracelet, not the highest quality, but it's one nonetheless. It's sometimes helpful to let people know if you do have Parkinson's that you're not just walking drunk down the street, or why you're so shaky, and sometimes it's pretty helpful just to identify you as having Parkinson's disease right off the bat. It comes with a medical alert card to fill out your information, just to keep it in your wallet. A medication form, like I said, to write out all of your medications. And these come in a tablet, kind of a tear off, like a notepad, so you can easily tear it off, hand it to someone, or rewrite them, however you decide to keep that out. It has a basic fact sheet that you can share with the Parkinson's hospital and staff. Like I said, again, it comes in that tear-off sheet, so you don't have to make copies or anything like that. You just tear it off and hand it to them. I have Parkinson's reminder slips that say important things like, I need my Parkinson's medications on time every time, restart them as soon as possible. These are the types of medications that I can't have for nausea, for psychosis, confusion, for depression, and this is what I can have. It gives them alternatives as well. Excuse me. One of the things that they add in there is a thank you card too. If your nurse is giving you medications every 2 hours and she's taking care of 5 other patients, please give her a thank you card. She's really busting her butt to help you out, but she wants to. That's the thing of it, is your nurses want to. They didn't become a nurse because they want to see how aggravated they can make you. They want to take care of you. And a magnet. A lot of times hospitals now have little whiteboards or magnetic boards where they keep alerts, fall risk, this, that, the other. You can stick this magnet up there that just alerts people that I do have Parkinson's. I'm probably more comfortable with dyskinesia than I am being stiff and rigid laying in bed. A lot of times staff don't understand that as well. So that kit comes with a lot of great stuff. You can get it, you can order it at www.awareandcare.org, or there's a link off of the National Parkinson's Foundation website that you can order it, or you can call a 1-800 number, 1-800-473-4636. I think they've had a lot of overwhelming orders for it, so they're probably, last I heard, about 6 weeks behind in giving it out. Check and see if your doctor's office keeps it stocked too. Sometimes movement disorder centers will stock a bunch of these and give them to patients they know who are going into the hospital. So when can you use it? Use it for a planned hospital stay. Bring it with you to every consult appointment. Pack it with your medications. Use it for an emergency visit to the emergency room. You can ask your care partner to bring it for you. You can ask a friend who might be able to grab it at the house. Annual check-in with your Parkinson's doctor, just to see if you need to add anything else, if there's any updates. Take it to your primary care doctor. There's a little tear-off of meds that they're probably interested in knowing what not to prescribe for you for depression. They're probably wanting to know not to give you something for your confusion or for your nausea that might make your Parkinson's symptoms worse. Heck, even your dentist probably would like to know. So, and getting into the last section with long-term care, it's a great thing for a long-term care facility to have on you, to have that information handy for their rounding primary care physician to know what they can and can't prescribe, to know that they have to give their medications on time. Again, that's another big issue about going into long-term care, is knowing that Parkinson's patients, when it's scheduled at 2 o'clock, they need that 5 minutes from 2 or 5 minutes after 2 and not a whole lot later, because for the medication to absorb, to get in, and ready for the next dose, it's very important. Switch back to my other slide here. Sorry about that. So with long-term care, again, it's difficult to navigate. Some of these places can be very big. An adult family home is a lot smaller, but skilled nursing facilities tend to be pretty large places. Staff is relatively stable, though. The day shift nurse is relatively stable. The night shift nurse is relatively stable. There might be multiples of them, but they come in quite a bit. It's a difficult shift, because if you're a care partner and your loved one is going into a long-term care facility, you might walk in on your loved one, see them for half an hour of the day when maybe their symptoms aren't well controlled. Maybe they're a little confused or tired or something like that, and you really have to know your nurses, know the staff there, and feel comfortable with going up to them and saying, "Hey, did he sleep well last night? Hey, has he been like this all day? Have you guys been given medications on time today?" Start getting to know them when you can ask these questions and feel comfortable asking. Have a dialogue with them. The relationship will go both ways. They'll feel comfortable with knowing who you are and coming up to you and talking with you as well. A lot of times these places will have therapists, will have speech therapists. Knowing them, knowing what they're comfortable with and working is important. If you're going nowhere with the staff, ask to speak to the director of nursing. She might be able to help look into matters for you. And also, it would pay to meet face-to-face probably with the resident physician. Who's in charge of your primary care at the facility? Who is seeing your loved one, and making recommendations. And if you really are getting nowhere, if you have a little bit of friction, there are people, they're called ombudsmen. I don't know why they're called ombudsmen. It's really hard for me to say with a cold, but there's always a local ombudsman. They were established by the Long-Term Care Act. I think of the Long-Term Care Act and Aging Act. I'm really bad with history, but they're there to be a neutral third party, to look into facilities, to help you understand the rights that you have as a patient, as a resident, as a family member, and help resolve issues between the residents and the staff, and make sure that your rights aren't being violated. But I think that ultimately the best work from ombudsmen are to be that neutral third party, to go in there and have someone to talk to about care issues and get them resolved. I have some websites up here for each of the states, Alaska, Idaho, Montana, Oregon, and Washington, that will list the ombudsmen. Usually they cover by county or regional area. I know Washington goes by county. There's one ombudsman to every county. I think there's a few in Montana, if I remember being there. You have to have a few to cover larger space, but they're there. You can find them. I found them in a relatively short amount of time, so I know that they're accessible. And so the references, besides National Parkinson's Foundation, there's a 3-ring binder book that the Davis Finney Foundation put on called Every Victory Counts. And it was designed as a 3-ring binder, not with information about Parkinson's, about treatment, but it has a lot of great information about how to be prepared for your doctor's visits, that you can go back on. You can have worksheets to fill out for yourself, for your own organization, but ultimately the way it encourages you to keep track of your disease, of your symptoms, of your medications, is a good, I think that's a good lifestyle modification to have for Parkinson's in general. All right, so that's the end of my slideshow. And I think we can turn it over to asking questions.
Well, that was an excellent presentation from Amy, and I hope you're able to get the information about Every Victory Counts and the different websites, for the Ombudsman. Is that how you pronounce it? Ombudsman. And if you weren't able to get it, just call our office, and we'll be able to get that information for you. That's the Northwest Parkinson's office, and our number is 877-980-7500. In fact, do you think we can put this information on our website?
Absolutely.
Oh, and we'll put it on the website. Just a minute, let me get my notes here. Okay, we're going to come to you now, and I don't know the way that our setup in at Evergreen. I don't know if you can see me or not, but I know you can hear me, so that's what's the most important. Okay, so we're going to go for question and answers now. So we're going to go to Anchorage. Anchorage, are you there? Anchorage. Okay, we're going to go on, and if Anchorage of you are, just let us know at the end. What about Billings, Montana?
Yes, we were wondering, is the list of meds not to be taken for nausea when you have Parkinson's included in that kit?
Yes, it is. It's, like I said, the list has medications that are not safe with Parkinson's disease, and then safe alternatives that people can try instead. And usually all pharmacies will have, especially hospital pharmacies, should have access to those medications too.
Any more questions?
Good presentation, and there are 6 of us here.
Wonderful.
Thank you.
Thank you. Now we're going to go on to Clarkston.
Okay, this is Clarkston. We have 13 people here.
Thank you.
Okay, the question has to do with bringing your own medications to the hospital. Do some hospitals permit PD patients to bring their own meds to the hospital? What are the restrictions? How do you negotiate this in the hospital? Can a PD patient keep the medication in their room and be responsible for taking it?
Okay, so this question, just for recording's sake, has to deal with bringing your own medications to the hospital. First and foremost, if you bring your medications to the hospital, make sure that they're in their original containers. Hospitals will want to verify your medications, and they'll do that either by contacting your pharmacy or asking for your list of medications and looking at your medication bottles. If they don't have a medication from your list, they will either supplement it with a different medication, which is usually not a best option in Parkinson's, or they will ask you to bring in your supply from home. And to do that, they really need to have that double checked by a pharmacist in the hospital in person. One thing that you can do is you can call your local hospital and just double check on that. And ask them, what is your policy for bringing in medications when I come into the hospital? Will you allow substitutions if you don't carry my medication? Like I said, one of the ones that they often have difficulty with is Stalevo, and the other is Comtan, then off of that. Did I answer all of the questions in that list?
Okay, tell her.
Thank you.
Okay.
Thank you. Now we're going to go on to Coeur d'Alene.
Hello, we have 8 people here today.
Thank
and,
you.
Thank you very much for an interesting presentation.
What was that last phone number sheet?
Oh, we have a question. What was the last phone number?
To the Northwest Parkinson's Foundation?
Yeah.
That number is 877-980-7500. And Amy has given us permission. We will be putting her presentation, the PowerPoint, on our website. So you'll be able to get the information there or call us.
Was that 1-800?
No, it's 877.
Okay.
Thank you. Any more questions? Okay, thank you. We're going to go on to Colfax. Colfax? Colville?
This is Colville. We have 2 in attendance, and excellent presentation. I loved the point that every healthcare provider in a hospital, from nurse up, doesn't know everything about Parkinson's. So that's just a great point to make. Thank you.
Thank you.
Thank you. Dayton? Grangeville? Kennewick? Miles City? Moses Lake?
There are 2 of us here today, and we thank you very much for your wonderful presentation.
Thank you.
Othello? Pendleton?
Hi, Lisa. Sue Peterson. We have
How are you? Where are you? Wait.
What was that again?
She wants you to wait.
Oh, hi.
Oh, there you are. I see you. Oh, hi there. Good to see you.
We have 6 in attendance, and the dog is here again. And thank you for the presentation. It was awesome, and we'll see you on Sunday.
Yes, I'll see you Sunday. Bye-bye. So
Go
we're going
Bees.
to go on now to Port Townsend. Pullman. Tonasket. Walla Walla.
Well, there's only one of us today, and I wonder if you could repeat that website that had to do with the kits. It had a wear and care in it.
Absolutely. That's at www.awareincare.org. O-R-G. Did you get that one?
Do you spell out the and, aware, A-N-D, care?
Oh, I'm sorry. Aware in, like inside.
Oh, aware.
So A-W-A-R-E INCARE.org.
Thank you very much.
Spokane?
18 in attendance, and thank you very much for a very good presentation, and our question was already answered about that website, so thank you.
Wonderful.
Great.
How many do you have in attendance?
18 today.
18, wonderful. And here in Kirkland, how do you two? Do you two have any questions? There are 3 here. Do you have any questions?
I think it's been answered.
Ah, your question's been answered. Okay. Now, did I miss anyone? Did I miss a location? Good, good. Well, I want to thank all of you for coming today, and especially I want to thank Amy for making an excellent presentation. We really do appreciate you letting us put your information on our website so everyone can have, access to the information that she shared today. Next month, our telehealth presentation will be August 13th, and we're going to have Helen Burrell Withworth. She's a retired nurse and a former Parkinson's caregiver, and she's going to be talking about how Parkinson's develop into Parkinson's disease with dementia. Also, on August 25th, we're going to have our Inland Northwest Hope for Parkinson's Conference, and that's going to be in Spokane, and you can go on our website to register, or you can call our office at Northwest Parkinson's Foundation for that. And if you'd like to order a DVD of the presentation that Amy made today, you can do that by calling the PRC at 509-473-2490. And I'd like to thank our hosts today, the Booth Gardner Parkinson's Care Center and Evergreen Healthcare. Everyone that's attended, we'd like to thank our sponsors and volunteers. I'd like to thank you all for coming today and getting all this wonderful knowledge from Amy. Thank you, and we will see you next month.